Hey, Simon, how are you?
I'm good. How are you?
Fine.
I
Yeah,
know.
I'm
How have
okay.
you been? Same here. Same here. Mm.
Yeah, it's all kind of just we all are imprisoned
Yeah,
this pandemic. Yes.
that's what that's what Corona is. I tell you, it's restricting a lot of people, especially traveling and stuff like that. What's the situation like in India?
Yeah, in India, like if I say it's not that much effective, like in countries, Western countries, which have a very cold weather. In India, it's not like that much effective, and right now it's cases are dropping. It's declining very rapidly.
Mm.
Yeah, it's almost yeah, and we know we got the vaccine too,
Yeah.
Covaxin and the Covishield. There's two vaccine which we produced here.
Hmm.
Covishield is based on the Oxford University, AstraZeneca and Oxford collaboration. They have produced the same vaccine is manufactured in a heavy scale in here India and called
Oh,
Covishield. And the
we don't
another
have
one is
that
Covax.
here.
Yeah, sorry.
We don't have that one here. Covishield.
Yeah, yeah, not have. I think in Switzerland, you guys have a Pfizer one, right?
That's right.
The
That's right.
vaccine that produced by the Pfizer,
Yeah.
and the other one is produced by the Moderna.
Yeah.
But I think Pfizer one is more popular.
Yeah. Yeah. Thing is, our numbers are on a steady increase right now. So we're talking about we are getting over 1,000 newly confirmed infections a day. So uh,
Really?
yet
Mhm.
yeah, the advantage of being a small country with a small population, you have a bit of better oversight, and
Mm.
so everybody's registered, and the government knows where everybody lives. Hence, you're basically you have a very clear overview. But 1,000 numbers
Right.
a, is a threshold which, in my opinion, is pretty high for a small number. Because if you think 1,000 people and everybody's gonna, infect further people down the line, so we have steady increasing numbers. Yeah.
Mm. But since a small population number, so it can be managed very, very strongly and greatly.
Yeah.
Like, like if your country wants, like they can just vaccinate in few months, cover few months all over the population. You can get vaccinated. Like,
The,
what is the population number? What is the population of Switzerland right now?
about 8.5 million.
8.5 million. So like, yeah. So 8.5 million. It's like, it's like
Yeah.
it's a very small part of even in my province is very in the UP.
Yeah.
So it's a population right now is 24 crore,
Yeah.
or officially I guess 22 crore. So
Yeah.
22 crore means it's a 220 million.
Big
220 million.
220 million.
20 million.
That's a different scale. So what does
Yeah.
India do to keep the numbers low, to have decreasing numbers?
So yeah, it's kind of very complicated issue, very complex. If I say like after when the government is opened the lockdown, just they remove
Mm,
the lockdown, and it's suddenly start getting declining.
mm,
The rate of infection is declining. Even the rate of mortality is declining very rapidly.
yeah.
So it's you can say it's like almost maybe herd immunity. We all
Mm,
are immune, and I guess that we are all very much equipped, equipped in terms of Ayurveda. You know,
mm-hmm, mm-hmm,
the traditional medicines which we used to take, which we used to put in our cuisine,
You
in
mean
our
curcuma and stuff like that?
yeah,
Uh,
in our eating stuff, our eating habits. You know,
yeah,
spice. We used to do a
yeah,
lot
yeah,
of
that's right.
spice. Yeah, na? Yeah. If you
Yeah.
remember those days.
Well,
Yeah.
the thing is here we're not, although an effort is made on healthy, sustainable food, but we certainly,
Mm.
the food here is not, doesn't have all these natural ingredients here. So
Mhm.
and although you're able to buy curcuma on every supermarket and stuff like that, but you're not like, it's not a
A
steady.
regular habit. It's not a regular
Yeah,
ingredient in your food. That's
exactly,
yeah. And
exactly.
in our here, it's all like a regular ingredients like turmeric, like uh,
Yeah.
asphodite. So many things like regular use. And apart from that, also like I was involved in the testing, COVID-19 testing, and for a precaution, I
Uh-huh.
used to take a blend of herbal drugs.
Uh-huh.
And if I reveal to you, it's a main there the principal component of that drug was gold.
Gold.
In I yeah gold yeah and and it was a gold bhasm, Swarna Bhasm, that is called Swarna Bhasm.
uh,
you know so that Swarna Bhasma is used to cure many different ailments, diseases, and it's known for the increasing the immunity.
right.
Yeah. And if you search the gold based medicines for curing the coronavirus, there is a 1, 2, and 3 and 4 papers will come.
Mhm.
There is a one paper is published in the 2020 is gold metallo drugs to fight the coronavirus, inhibitory effects on the spike ACE2 interaction and on PL pro protease activity by Oranofin and gold organometallics. This was published in CAM RXV. It's a preprint in 2020. Gil
Oh,
Moles was the first author, and then again they published this paper in the chemistry, in the Journal of Chemistry, finally,
uh,
and they put the title like "Gold Metallo Drugs to Target Coronavirus
well, we
Proteins."
talking about gold, the metal gold, right?
Yeah, metal gold. Gold metallo drugs to target coronavirus proteins.
I never
Inhibitory
heard of that.
effect, yeah, inhibitory effect on the spike is H2 in interaction on PL pro protease activity by ornithine and gold metallomex,
Oh,
gold organometallomex.
okay, interesting.
Yeah, that's very interesting. And there was a expert opinion on drug discovery in 2020 also published, and they say that metallotherapeutics for COVID-19 exploiting the metal-based compounds for the discovery of new antiviral drugs.
Uh,
So there is a lot of thing about the metal. And
yeah.
uh, why I'm interesting because I've been working on metal since last 15 years. You know,
Uh-huh.
yeah, since 2005 when I start doing my research, I worked on metal. I worked on cadmium. I worked on arsenic. Arsenic. There is a
Yeah,
metal arsenic, and
yeah.
in in an alternative drug like homeopathy, there is a drug arsenic called as arsenic alba,
Mm.
and they simply administered to the patients, and it works. So this heavy metal thing is great.
Mm.
Like for the and after the arsenic, I worked on the gold in
Yeah,
the that university, Western Kentucky University, where we met.
yeah,
you know,
yeah. Yeah.
and at that place, I worked on the gold. And
Interesting.
when I worked on the gold, I really came across to the surprising thing. And that paper was published in the Frontier in Plant Sciences in 2014, in which I was the first author. And we did the
Yeah.
genome-wide transcriptome analysis that reveals the ABA-mediated response in Arabidopsis under the gold treatment.
Oh, what do you reckon is the efficacy of that?
Yes. So that surprising thing, it was revealed that during the like only 12-hour treatment of gold to the
Yeah.
Arabidopsis plants, we gave that just 12 hour to the treatment of orochloride HAUCl4 to the plants, and within 12 hour it changes the whole transcriptome of the plant. Total
Uh-huh.
shift in the transcriptome, and
Okay.
the pathway which governs the flavonoids pathway is completely upregulated.
Wow.
Secondary metabolites pathways upregulated. Glutathione related pathways upregulated. There are a lot of GSTs is upregulated. So
Uh-huh.
gold has tremendous power to modulate your metabolism. Even if in the plant, same in the there's
In the
maybe
body.
need to do a lot of research, but
Mm.
in our ancient system knows that in Ayurveda this gold bhasm, Svarna Bhasm is like from last 5,000 years maybe we are using
Mm.
it as a cure.
Mm.
Svarna Bhasma is used for different kind of uh,
Yeah, curious. How can
mm,
you, you know what? How can you bottle that? How can you, how can you make
yeah.
that into a pill?
Mm. Just hold on. Give me a second.
Yeah.
Uh, just I need to little pause it and tell it, hold on. Give me a minute.
Sure.
Okay. Yeah. So that gold-based drug, I
Mhm.
think now it's getting attention in the different countries, even in the modern science. Now they are
Yeah.
just the same drug which I mentioned, auranofin, based
Mhm.
on gold, and they are testing its efficacy on the virus replication, and it stops replication, and even it blocks the ACE2 receptor, which binds
Mm.
to the virus spike proteins.
Virus.
It
Yeah, yeah, yeah.
blocks the spike protein also.
Yeah.
That's very interesting thing actually.
Oh.
So yeah, that's.
How do you foresee the implementation of that? Like, how can you make that available to
So
other people?
so yeah, that's a great thing you mentioned it. So like why it is one of the reason why in India this COVID-19 is not that much effective,
Mm.
because here is the traditional doctor is called Vaidya.
Mm.
Okay, or these doctors prescribed it. They used to give these things, different bhasmas, metal bhasma, like Swarna
Mm.
Bhasma, Abhrag Bhasma. There is a uh, silver bhasma was also.
Yeah.
They make a blend of different metals bhasma, and they gave that. They used to administer it. So
Mm.
it's a underlying kind of thing. It's
Mm.
going on,
Yeah.
and that's why this is the reason that so we are in a good situation, because
Oh, that's good.
if like a person is getting it maybe in earlier year, not this year, but it remains inside the body.
Oh yeah.
It,
For how long?
for long time it remains. It goes out, but still it remains in the form of the particles. You
Okay.
can say nanoparticles, and
Yeah,
it
yeah.
works. So their immunity is different from the
Was
other.
it?
Yeah.
Mm.
So that's very pretty interesting and need a lot of research, I guess. Need
Uh,
to lot of focus and research. Like for my case, if I say my thing, there are I think related 20 cases, 20 people to whom I know, and they
mhm.
got positive, and
Yeah.
I suggest them take
Uh,
this. There is a one drug is called Vasant Kusumakar in Ayurveda.
uh,
One drug is
Oh,
called
send me that link, please.
uh,
Send me later. Send me that link, please.
yeah, I will send you the link. So there is a
Yeah.
drug called Vasant Kusumakar and Vasant Malti.
Mm,
So 100 mg Vasant Kusumakar, 100 mg Vasant Malti, and around like 10 mg or 15 mg Svarna Bhasma.
mhm,
And there is a one thing is called as Ayur Defense.
mhm,
Just take one tablet of Ayur Defense. It's 650 mg,
mhm.
and just all these drugs you need to make a blend of it using the
Yeah,
pestle and mortar.
obviously. Yeah.
I'll send you the link. I'll send you all the
Sure.
link.
All right.
You see
Appreciate it.
Vasant Kusumakar, Swarna Bhasm, Swarna Malti, and all.
Uh,
And you just take these 100 mg Vasant Kusumakar, 100 mg Swarna Bhasm, sorry, 100 mg Vasant Malati, and 10 to 15 mg Swarna Bhasm, and 650 these Ayur Defense.
and that, and
And,
that's it.
and then you make a blend of it. Just
Uh,
grind it as fine as possible with the use of pestle and mortar.
uh,
Grind it as fine as possible and just take it twice a day or once a day for next 10 days. Everything will be gone.
mm.
Yeah, it works
But
very greatly.
this will further prevent you from. I mean, it's gonna
Yes.
build if it's gonna
Yeah,
like, if it's gonna block the proteins on the virus. It's gonna keep up the immune system for later on. That's interesting.
that's interesting. Your immunity level will be high for a
Mm.
certain extent, and
Yeah,
it's a very rare. Then you will probably you will not got infected.
yeah, 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 yeah.
You will
Interesting.
not got infected probably.
Mm.
Yeah.
This could be the cure.
Yeah, that's like as far as I know, to whom I prescribed. I'm not a doctor, and yeah, I'm not a doctor. I'm not suggesting it, and but as far as my experience is concerned, my understanding and my result which I came across, it works very well.
Mm.
I'm not suggesting people to take it. You should, but I should reveal. I should share it. Today is the Science Day in India. It's the 28th
Yeah,
February. Today is the Science Day, so I must reveal these things.
do
People
it.
should know it. They should consult their Ayurvedic doctor or other doctors, and if they
Mhm.
find, yeah, they can take it. If doctor said okay, they can take it. But it works. Yeah,
Yeah, that's good. They should do it.
yeah, they should
Promote
do
that.
it.
Promote that
Yeah,
aspect.
yeah, I'm
Of
just sharing the secret or sharing the thing that yeah I came across and it works very well. So for the sake of the public good, I guess I think I should must say it. So I just openly saying it across the world. Ayurveda just it should be gone, right? Should be everywhere
of
on the
course.
occasion of the Science Day, I guess.
Yeah,
Yeah.
go ahead. Yeah, you should do that. Go ahead and promote that, and maybe some further research will come along to further
Yeah,
underline this.
yeah, that's very important thing. Research is needed. Further research is needed. Thorough research is needed on the how the sword bhasm works.
Mm,
How the sword bhasm works. A thorough research is needed. Yes, and it works in many diseases, many elements. It increase your IQ level also.
yeah.
Swarna Bhasma, yeah, it's known in Ayurveda. They say that it increases the IQ if you are
Maybe
taking the.
probably promotes the efficiency of the brain.
Yeah, it promotes.
Yeah, yeah.
Yeah,
Interesting.
yeah, yeah. Give me a
Cool.
moment. Sorry,
Sure.
just. Yeah. So, yeah. So I guess actually metal-based drug, the modern science or modern medicinal disciplines, they're just afraid of drugs, metal-based drugs.
Well, the thing is, it's actually an older way of treating people, but with the introduction of modern medicine, the whole science of metal-based medicine has gone under the radar, I think.
Yes, it's gone under the radar. They say that it's a toxic,
Yeah.
but the making of the medicine in different ways, it's just become detoxification of the metal-based drugs, and they didn't cause any toxicity to the body.
Mm.
And
Sounds interesting.
it's a time-tested medicine. You know, if it is like that, it should be gone. It should be vanished if it is not worked. Since it's been using since last 5,000 years, no
Exactly.
problem. If it is
Exactly.
toxic, why it was still there? You know, if
Yeah. Well,
something is tested, then it's survived only. It's a time tested. It's survived from long time.
well, you should go ahead and promote that.
Yeah, I was just I don't know, but yeah, on the Science Day, I think I should just say it. Talk to your doctors, talk to your physician.
Uh,
I'm not prescribing it. If they say it, yes, have it. You can just take it, test it. It works. It worked for me and for many people to whom I prescribed them. It
mhm.
worked. And maybe it worked for you or other people. So yeah, it's a sharing thing.
For some
Sharing.
reason, I haven't contracted any of the COVID so far.
That's a
I've
great
not.
thing.
I've yeah. I don't know.
You did a great
Every,
job.
yeah. I don't. By doing what? I don't know.
Huh?
Everybody around me got it.
Everybody around you got it because you I good, very good. Yeah.
Yeah.
You
Wow.
develop your
Cool.
immunity. Yeah.
Yeah. Definitely. Definitely.
Yeah.
Well, go on ahead and post it. It's what time is it there now?
In India, it's evening, 6:45,
Yeah.
close to 7
Yeah.
evening. Yeah.
Yeah. You should go ahead and promote it while it's still Science Day.
I think, yeah, it should be. I
Yeah.
need to say it something. And
Yeah.
also, one thing is also quality. Quality of the Ayurvedic drug is very important.
Mm.
Yeah. If you got the highest quality drug, there are some few companies, I don't want you to take the name of those companies, but there is a lot of thing is there. The very good company, great company, it's very expensive. One of the
Yeah.
problem is that it's very expensive, you know. It's
Yeah.
like yeah, like 1 gram means 1000 mg, it cost 5,000 rupees in Indian
Mm.
currency, 5,000 rupees.
Yeah.
So
Yeah.
it's a 5,000 rupees means if I say in dollars,
Mm.
it will be a like around $100, less than $100.
Mm.
It's expensive. Not
It's pricey.
everyone can have it. No,
Yeah. Yeah. Of course. Of course.
yeah, like I'm
Yeah.
I'm I'm talking like best drug, best companies, highly standard
Yeah.
companies. This when you got those product from those company, these
Mm.
product from those company, it's expensive. So one of the reasons is that, so that's why also everybody is not able to have these drugs, these
Mm.
Ayurvedic formulation. It's very expensive. Yeah.
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 But then if if more people would use it, it would actually put the price down of the product because of economies of scale. You know what I mean?
Actually, yeah, actually, it's also depends upon the gold price because it's made up of gold.
Uh, of course, that is heavily tied
Yeah, if
to it.
gold
So
price is rocketing, skyrocketing, drug
yeah,
is also skyrocketing in same
uh,
place. Earlier it was like 3,000, now it's 5,000. Earlier like it was in $50. Maybe you can buy in a 50, now it's take 90, $100. Yeah.
of
Yeah.
course.
Yeah.
Yeah. See what you can do.
Yeah, I think I just need to share it. So I share it with you,
Yeah. I appreciate
and
that.
I will share it across the world so
Yeah, you
that
do that.
it's a
I would
ripple
definitely
effect.
look into it. I would definitely look into it. And
And my question, how did you protect yourself? Like people around you all got infected, but you didn't. So what you did or anything? Wear the mask always?
oh, always, yeah, always.
Always, yeah, good,
And
good.
well, basically, I don't change much on my diet.
Mhm.
Mm, I wouldn't. I don't know if I could attribute that to my diet. My diet is pretty much the same. I'm not eating Ayurvedic food as of now, but coffee in the morning, and that's just basically it. Meat, meat-based diet.
Mm-hmm.
Um,
Mm-hmm.
no fruit, little
No fruit,
vegetable, no
no
fruit at all.
vegetable.
Very, very little vegetable.
Mm-hmm.
But see, I'm keeping my diet on a constant, so I do this,
Mm-hmm.
and that's basically it, though. But I,
Excuse
I
me.
have not been sick in over a year, like not in not
You did a great
two
job, bro.
years. 2 years in last time I was sick, it was 2 years ago.
Mm-hmm.
With my way of keeping a constant, which I must say is not the healthiest way, but uh, there's no fresh vegetables at all, like no salad, no fruits,
Mm-hmm.
cooked vegetables, yeah, but not many.
Mm-hmm. Great. Mhm.
Which is not very Ayurvedic, but
Yeah, it's not. It's pretty. It's true. It's not very Ayurvedic. Yeah, it's not at all. Yeah.
but that was, but
So
mask.
when will you expect it to get shot, vaccine shot?
I don't think I'm gonna get it.
You will not get it. You don't
No,
want it.
no, I don't want it because I'm
Yeah.
not a risk. I'm not in the risk group,
Okay.
and the fact that I haven't gotten it in over a year, proves that I can basically take care of myself in a responsible manner. My parents didn't either.
Excuse me.
My parents didn't get it either. My dad
But
is 76. My mom, is 66, so they didn't get it either.
but they are in the risk group.
They're in the risk
It's
group, but they're not gonna
it's
get it either.
severe.
They don't want the vaccine.
Yeah. So tell me the reason. Why is it in Europe people are not much very fond of vaccine? They are not pro-vaccine. Why?
Me, personally, I think that it came out too quick, and for me personally, I don't see the reason to get it because to me, it's a flu. It's a more drastic version of the flu, the
Yeah,
COVID.
it's true. It's a drastic version of flu. It's highly yeah, changed.
But
Yeah.
therefore, I don't. For me, myself, and my parents, we don't see the reason to get it. They're in the risk group, absolutely, but
Mhm.
they're able to protect themselves.
It's fine. So
So
in yeah. Hmm.
for me, like if I get it, yeah. If I don't get it, okay. If I get it, I let my body take care of it. If or with if I get it and I struggle with it, I would resort to possibly now an Ayurvedic option of taking care of that.
Okay. Yeah, if you got these medicine which I told you, yeah, you will be Superman.
Then
Yeah, yeah, they work so great.
yeah,
Yeah. Yeah. In India, to also like there is a prioritize government prioritize to give the vaccine shots to the first to the elderly people, senior
yeah,
citizens, then under 50. It's like
mm,
that. First to the health workers, frontline workers,
of course,
the guys who is involved in the frontline at hospitals, at testing centers.
yeah,
First, they got the shot, and after that, in a phase by phase manner, will finally will get the shot. But I will definitely get a shot. I'm a pro vaccine. I will definitely, when will offer to me, I'll get a shot with the family, my kid and all. Everybody should get it. Pro vaccine, you know. And India has a great manufacturer of a vaccine. Now we are exporting our vaccines, Covishield and Covaxin, to the
Yeah.
50 countries. 50 till this day, we have exported millions of doses to the different countries all over the
Yeah.
world. Brazil, African countries, so many countries, different countries. Sri
That's good.
Lanka, all neighbor countries, Nepal,
Mm,
Bhutan. Yeah.
it, that's good.
So,
Me?
yeah.
I don't know.
Some country, a country gives the virus to the world. India
Yeah.
gave the vaccine to the world.
Yeah, yeah.
You
There
know,
you go. That's the solution.
yeah. Somebody gave the virus, we are giving the vaccine.
Yeah,
That's the thing, the
that's right.
creative thing, on the Science Day.
Yeah.
Yeah, that's we are
That's
doing
actually a
it.
good point. That's actually an interesting point to look at it.
Yeah,
Uh,
yeah,
yeah.
man.
Hopefully, yeah. Well, I mean, if you can, work both ways. Let's say a modern vaccine and a Ayurvedic vaccine, in a sense that with the precious metal and all that. So it'd be good in combination. So you
Yeah.
can actually compare the parallels of both efficacies.
Yes, Simon, you pointed out very nicely. This is efficacy. It should be tested in comparison to the modern medicine. I'm totally in favor of that. And my point is that since it is time tested, it is here around like thousands of years, at least 5,000 of years is these metal-based bhasma is there, and they are very nicely using. People are getting it, so
Mm,
I guess it's a great thing, and we must tested it properly. We must follow all the rules and regulation of the new for drugs, formulations of new drugs, and
mm.
then we can do it. We can put it to the market
Yeah, yeah,
uh, at the same at par with the modern medicine, if I say.
yeah, yeah,
Yeah,
yeah.
at par with the modern medicine, we can put it. There's a lot of
Okay.
research is needed. Yes.
Yeah. Mm. Sounds interesting. I will definitely Google. I would definitely do some research and see what it is all about. Because I mean, there's somewhat a track record
Like
of that.
for example, if I say I was also like many people close to me got
Mm,
positive, got infected. Many people in which to whom I was in contact,
yeah.
but I was not. Simply, I was taking that, and I was not. So,
But that
and
that's the thing. I work my three immediate co-workers, they got it. I didn't
Mhm,
get it.
mhm.
That's interesting.
That's very interesting. Yeah, it's all about, I think, immunity. How much your body is just manage them.
Yeah, true indeed. True indeed.
Yeah.
Yeah. Well, all right.
Okay,
Go
man.
ahead.
We'll
Yeah,
we'll promote it. We'll see it. I think it's for the public good, for the common good. If something is good, it's must be
good.
shared.
Absolutely.
Again, I'm not a doctor. I'm not prescribing it.
Yeah.
Whosoever listen it, just their responsibility. Your health is your responsibility. You just talk to the
Yeah.
doctor, talk to your physician, and if they say it, you can have it. Definitely. Yeah, I guess. Okay,
Sounds
man.
good.
So
All
yeah.
right. Hey, I'll call you next week again, okay?
Okay, man. See you again. Nice
See
talking to
ya.
you
Take care.
on the
You too.
Science Day.
I
You
know,
know?
right? Happy Science
Yeah.
Day.
Happy. Bye
All
bye.
right.
Take
Bye.
care. Bye.
Bye.
Bye. Bye.